When thinking about healthcare economics, there's a couple things you have to remember with the market for health insurance. The first is moral hazard. Well, what's moral hazard? Moral hazard is thinking about actions people take when they have health insurance versus actions people take when they don't have health insurance. So, for example, people with health insurance tend to engage in riskier behavior. Okay? For example, you might play softball or you might play soccer, knowing full well that if you break an arm or a leg playing those sports, you have health insurance to cover you. Whereas somebody who's not insured may not play soccer or softball because they don't want to run the risk of injury and then have a really expensive proposition. There's also self-selection. If you're young, healthy, and you know you're not sick, you may not buy health insurance, especially if it's expensive. Because after all, you're paying for a product you might not use. So young people tend to pick catastrophic insurance. In other words, if something really bad goes wrong that you can't predict, like a meteor falls and hits you and you break an arm or something like that. People who are sick, who know they're sick, who have better information than the insurance companies do, they will buy health insurance. And the fact that they're buying a product that they have better information on than the insurance companies means we have a self-selection problem. So now if you look at health insurance in the country, the price of health insurance keeps going up. Well, people who are young who aren't going to use health insurance see it as a worse and worse proposition, therefore they drop out. They don't buy health insurance. People who are sick view health insurance as much better proposition. They're going to keep buying health insurance as the premiums go up. Remember, the healthy people are dropping out, so insurance companies are left with sicker and sicker and sicker pools that are more and more expensive. And if you think about revenue or profit neutral insurance, you take everyone's healthcare costs, divide it up by the number of people, and that's how much everyone should pay in a premium. So if everyone's sick, everyone's insurance costs are going to be high. So the idea that we only get sick people participating in insurance markets and all the young people are out, this is kind of the death spiral. And as insurance becomes more and more expensive, this problem gets further exacerbated.